Thank you for coming to our healthcare forum to talk about Trump Care. I'm Amy Cuthbertson. I'm going to act as moderator this evening, and I'm going to start by introducing our panel, and then they will introduce themselves and give their perspective of where healthcare is now. They'll speak for a couple minutes each, and then we'll open it up to questions. Okay, so our panel this evening is Amanda Birdwell. She's a registered nurse with the Center for Spine and Joint Excellence at Christiana Care Hospital, and she's also a candidate for the Oxford Borough Council. Next, we have Christina Hartman. She was a 2016 candidate for U.S. Congress for the PA District 16. After that, we have Patricia Maizano. She is the founder and CIO of iCore International, which is a healthcare company that provides patient advocacy and professional guardianship services to the profoundly disabled and to seniors. She's also the current candidate for Chester County Treasurer. After Patricia, we have Mary Beth Rizzo Moore. She's from La Comunidad Hispania, and she's a registered nurse practitioner in Oxford. Then we have Anna Roosevelt, also from La Comunidad Hispania. She is a behavioral health consultant. And finally, we have Ted Trevorrow, a lead healthcare navigator for La Comunidad Hispania.
Hi, I'm Amanda. I want to preface this by saying that I don't speak for Christiana Care Hospital. They have a very long addendum on their website. I also want to say that I don't have all of the professional and political experience of some of my co-panelists, but I do have a lot of opinions, which is probably how I ended up here. And I also have experience in my personal life living with a pre-existing condition, but always being covered by employer-sponsored health insurance, then working every day with people who, because their disabilities and their pre-existing conditions often don't allow them to work consistently, or because they don't have jobs that provide the same benefits as the ones that I have had, don't have that access, and so they can't rely on continuous employer-sponsored coverage. I take care of people from all walks of life. Some of them have disabilities they've dealt with their entire lives that require them to have neurosurgery on their spines or orthopedic surgery. Some of them are in traumatic accidents. They have cancer that metastasized, and this is a new thing for them. They're suddenly unable to work. But if you walk onto my floor at any given day, regardless of the situations or the backgrounds of my patients, you would see that none of them are in a position to go back to work when we discharge them. And most of them either weren't working before, won't be working now, or have jobs that are going to be jeopardized by the amount of time it's going to take them to recover and the amount of support and expense that they're going to incur during that recovery process. Many people, even working people, don't necessarily get FMLA, or they can't afford to take it because it's not paid. And so one of the things that was really significant for me and for the people I work with about the Affordable Care Act is that it began to sever this connection we have that if you work hard enough, then you can deserve health care. As a nurse, one of the things that is the key part of my job is prioritizing. There are a lot of things that people need, but what do they need first? And so working with people who are disabled, who have become disabled, you're able to see that a system that insists that you work to earn your health care is a system that fails to recognize that somebody whose health is compromised can't necessarily go to work until they earn that health care. And when you insist that they do and withhold coverage and health care from people who cannot work, is not just an issue of compassion, it's an issue of efficacy and expense, because those people have worse outcomes. They can't contribute to our communities. They end up being less independent if they are able to even continue to live, and it costs people more. And so one of my concerns about Trump Care and about these proposals is that what I see in all of them is a prioritization of philosophical ideas about who deserves what over the basic practical issue of what is the best thing for individuals as well as for our community. So that's why I'm here.
Thank you. I'm Christina Hartman, and as Amanda mentioned at the beginning of her remarks, I too come to this table as a user. I think that we all need to remember that we are users in a healthcare system. So while I ran for office in 2016, and I'm likely to run again in 2018, this experience comes to all of us in the same way, which is that we have medical issues that we have to deal with in our everyday lives. And I, fortunately, am a very healthy person, knock on wood. My husband, on the other hand, has two pre-existing conditions, one of which such as cancer. So my husband got cancer a few years ago, and while he's in remission and he's okay, he has the kinds of conditions that Amanda was referring to that need to be treated that cost a significant amount of money after the fact. And so what we see right now, and I'm sure you all Dynamic Dems have had your television on or have read the newspaper today. So I'm sure that you're aware that the Senate bill for their new health care, which isn't care at all, and it's certainly not about health. I'm not actually sure what it's about, but it's not about those two words, is currently up for debate. It was going to try to be passed, and that has been delayed until after the 4th of July. So what's clear at this stage are a few things. One, the bill that was passed by the House of Representatives, including the representative from this district, Lloyd Smucker, voted in favor of the House of Representatives AHCA bill. The Senate bill looks very similar. So while many people argued that the AHCA bill from the House might be bad, that the Senate would clean it up. And that in fact has not happened. The Congressional Budget Office, as you're probably aware, came out with their results yesterday, which tell us that 22 million people will lose their health care coverage over the next 10 years if this bill is to pass after the 4th of July holiday. And so what it means, of course, is a higher cost for most individuals, particularly seniors. I saw some estimates recently. If you're around the age of 60, your costs would go up by $12,000 or $13,000. It's outrageously expensive for folks. And these are, again, 60 years old. Last time I checked, is getting closer to 65, and an extra $12,000 isn't the sort of disposable income that one has at that age. And my parents are of that age, so we know that well in our family too. So less coverage, higher costs, all of these things are something that we don't want in a bill. We want to make sure that all Americans can afford health care coverage. And there's a number of ways to do that, and we can talk about that in Q&A. But mostly we want to ensure that the tenets of the Patient Protection and Affordable Care Act are kept in place, that we're covering pre-existing conditions, that we're covering when women go in to have a baby, maternity care. All those things are basic needs that should be covered. And it is unfortunate that we are the only country in the Western world that doesn't actually have comprehensive health care coverage. So we need to work towards those things in addition to protecting Medicare and Medicaid. As so many of you know, any child with a disability may be receiving funds or supplements to their needs through Medicaid, and we need to make sure those continue. And again, our congressman, unfortunately, in this district has said that he's happy if those things are removed. At last count for the AHCA was going to, that bill was going to impact upwards of 40,000 people in Pennsylvania's 16th congressional district.
Hello, I'm Patricia Maizano, and I'm here today as the founder and CIO of iCore International. My company deals and has dealt with advocacy on the healthcare end and the financial end for seniors and the catastrophically disabled. I'm going to make my remarks based on those experiences and living with those experiences in the field. What I felt before, I'm going to keep referring to it as Obamacare because I believe he deserves the credit for it, and what has happened after Obamacare and now what we could be looking at. I'd like to focus in mostly, I deal with Medicare and Medicaid, those two arenas. Medicaid being state by state defined, I'd like to stick to Medicare for this because it is nationally defined. And say that prior to Obamacare, we had many people on Medicare, and their Medicare benefits were reactionary. They were not proactive. So I use the example, if an individual had a low sense of balance or their balance was off a bit, Medicare would not get them a walker or a wheelchair, even a cane, in order for them to prevent falling. However, Once the individual fell and broke their hip, Medicaid would then buy them a walker or a wheelchair, along with the $30,000 or $40,000 surgery it took to fix the hip. It started because of some abuses of the system, but all places giving postoperative therapy care, and every day they had to put in real time what every single patient was getting in therapy. And if that patient refused therapy or did not progress for 3 days consecutively, their Medicare was over. So if you were tired, you were not allowed to be tired. If one day was not a good day for you, that goes against the 3 days. So there were people who literally lost their Medicare coverage 3 days after they were hospitalized, and that happened a lot. Under Obamacare, all those things were removed from the Medicare platform. Under Obamacare, it became a preventative system, not a reactionary system. They would get you the wheelchair and the walker instead of waiting for you to break your hip. Therapies were extended to give the person the maximum amount of therapy to bring them back to the level that they were prior to their injury or illness. That was a tremendous benefit to the people receiving those programs. The other thing I'd like to just touch upon quickly is general health insurance in this country. And I'm going to relate some facts that were actually provided to me, and we've seen them now as ICOR is a national company. Health insurance companies do not necessarily provide, or have not necessarily provided, until Obamacare, the care uniformly throughout the United States. So, for example, in Arizona, if you had health care, it did not matter what your condition, you were never covered for pregnancy, prenatally, postnatally, nor was your child should there be a medical condition for your newborn baby. That was Arizona's way of trying to minimize the amount of what they thought were illegals or third world country people coming into their state. California was even a bit worse. California insurance companies had the ability to list anything as a pre-existing condition. So I want to give you an example of how far they would take that. A woman I know that does this completely for her career was working with a gentleman who was skiing and broke his leg. And he was denied coverage because when he was 10, he broke that same leg. That was a pre-existing condition under California statutes. So Obamacare took that away too. Now, what we're going to end up now, as Christina said, I haven't a clue. We know it's a wait, but I think that the protests and the anger that people are showing, the Republicans are not going to be able to put together any kind of reasonable plan. Maybe remove a couple of the things from Obamacare, like the expense if you didn't get insurance, there was a tax. But other than that, Obamacare was a pretty good plan. And let's go back to what is probably the best plan in my view, and that's Medicare. How long has it been around? How much has it helped the people who've had it? Why are we not extending Medicare? That's the question I do not know.
My name is Mary Beth Rizzo Moore, and I'm a nurse practitioner at La Comunidad Hispana, and I practice family medicine. And for those who aren't familiar with nurse practitioners, what I do is I am certified by the state of Pennsylvania to practice family medicine, and that encompasses the lifespan, so infants, children, and adults. We focus on primary and preventative care. We also treat acute and chronic illnesses. And I'm fortunate that I work at La Comunidad because I see a variety of patients in our community, in my community, because I work at both offices, Kennett Square and Oxford. It's a unique position because I see the patient at the point of care, and they tell me a lot of things. And they tell me all their fears, their concerns. They're worried about their children. They're worried about what's going to happen next for their loved ones that are on Medicare, or if their insurance lapses. And we see today they've announced they're like leaking out a little bit of information about what they want to do. And one of the things that struck me was that if you had a gap in your insurance, it wasn't going to be so easy, and it was going to cost you more to get back on it. I hope that doesn't happen. We'll have to wait and see, and I'm hoping that after the break, our congressmen have some time to reflect and really think about what's going on in our country and what's happening with real people. In our clinic, we are a federally funded healthcare clinic, and if you've never been to one, we cover everyone. People with insurance, people without insurance. You could have no money and you will get care at our clinic. And I think a lot of people in the community are becoming aware of us now, and we're really trying to get everyone in our community to say, hey, this isn't just a clinic for, our name is La Comunidad, and some people think it's a place that's only for Spanish-speaking patients. That's not true. We open our doors for everyone in Chester County, and we encourage everyone to come, and we have women's health care, we have family medicine, we have behavioral health, and we'll tell you about that. And we also have a range of social services and people like Ted who help people enroll in Medicare and to get on the health exchange. So when you come to the clinic, we're really offering a lot more than you would get at a private family practice. We also have diabetic education, and we have a lawyer. It's really an umbrella for our patients. They have all their needs met. My focus is to always be a medical advocate. So no matter where my patient is in their life, whether they have insurance, whether they don't have insurance, I'm going to meet them where they are, and I'm going to give them the best care I can give them. I'm going to point them in the direction of the best and most affordable care. I'm always using my favorite apps to find the best and cheapest medications, because people don't know that every drugstore in this area has different prices for different drugs. And if you don't know that, I'll tell you the app that you can use to search your drug prices, and it's really amazing. If you go on this app, you will say, wow, I'm really paying that much more at CVS or Walgreens or Rite Aid or Acme. We try to use 430B pricing. We reach out to certain pharmacies and we see if they will accommodate our patients with this special pricing. It's for patients who have sliding scale insurance. So they have no insurance, they pay by whatever they make, and then we use that same scale in the drugstore. And I do encourage you, please, to always think of our clinic if you have needs. If your insurance changes, don't hesitate. Please come in and see some of our great providers. So that is my focus, medical advocacy.
My name's Anna, and I'm a behavioral health consultant at La Comunidad Hispana. So I work directly with Mary Beth. It's an integrated primary care center. So our patients come in for their physical health as well as mental health. I screen people for depression, anxiety, stress, and provide brief interventions. Mary Beth gave us a little bit of a overview of LCH, but we're fortunate to work there in that we've existed for a long time, for over 40 years, I think, and we'll continue to exist regardless of the administration. We do receive federal funds, but we also receive, you get money from donors. I've been working in mental health and also working directly with patients who've been coming in with a lot of anxiety about this new administration. A lot of fear around what's going to happen to their health care, a lot of fear around other issues, and families and children also, with fear. So that's something that I directly work with the patients that I see. In 2013, was working as a counselor for the Affordable Care Act through LCH, and was fortunate to kind of see directly the results of people getting insured for the first time, people who had chronic illness or fell into a gap between Medicaid and weren't able to get insurance before, or didn't have the required years of residency here. So I saw people who with chronic diabetes who were able to get healthcare for the first time and really see how that impacted them. So I've seen such, beautiful changes in healthcare over the few years. And I'm fortunate to be working at LCH where we can continue to work with people, but we're also kind of preparing for some changes, unfortunately.
Ted Trevaro with LCH. I do want to mention something Mary Beth said, that everyone is welcome. So we use the name LCH as often as we use La Comunidad Hispana to emphasize the fact that everyone is welcome at LCH. The gentleman has a shirt on here that says LCH Life Changes Here. So it stands for Life Changes Here as well as La Comunidad Hispana. So my perspective comes from one career in information technology at DuPont and another career in the life and health insurance business after DuPont asked me and about 800 of my closest friends to leave in 1991. I acted as a broker or agent for 20-some years until I retired in 2013. And in October of 2013, what happened? The Affordable Care Act was implemented in October of 2013, fell flat on its face. But I have worked as a navigator on the federal marketplace ever since then, since October of 2013. And a year ago, I was trained and became a certified apprise counselor in the state of Pennsylvania, which is the state health insurance program for Medicare advice, where people can seek help in enrolling in Medicare plans. So at LCH, I sit around and talk about Medicare and the Affordable Care Act all day and help people enroll in those programs or just answer their questions about which is the most appropriate program for them. And that's where I come from on this. Both experienced as an insurance agent, I know the insurance side of this stuff, as well as a counselor.
Thank you. So now we're going to open up the floor for questions. Does anybody have any questions for any of our panelists?
My question is, I think any of us that have paid attention to the debate about health care knows that there's a lot of problems, and you've all talked about many of the problems. My question is, what does a responsible, realistic person advocate for at this point? With the Republican control of the national government, with all that's out there in the media, fake and real, what's realistic to do that's better than wait till 2018 and hope that people like Christina get elected?
The paradigm has shifted. A lot of our representatives and so on haven't caught on to this yet. But what does the CBO say when they score one of these bills? 20-some million people will lose their health insurance. That's the headline. That's because that's what we care about now as a society. If the Affordable Care Act has done anything, it's to shift the paradigm. You have Republicans saying we can't kick people off their health insurance. That's what's changed. That's what we need to point out to the, what's his name? Schmucker. He missed it. He didn't get the memo, right? We don't now do things that usher people off of their health insurance. We have 91% of our population covered by health insurance, the highest in our history as a nation. We don't want to go back from there. Not only do we not want to go back, we want to go forward. And everybody, almost everybody, agrees with that. And if you called me up and said, what should I do? I'd say, pass the word. You missed the boat, Mr. Toomey, who said, I promised I was going to repeal it, that's what I'm going to do. Well, in the last 8 years, since you promised that, things have changed.
I think one of the things you can do for yourselves that everybody can do for themselves is try to be a good advocate for yourself now. And as a nurse of 45 years, I will tell you, out in the community, doctor groups are forming. So now there is, for example, one cardiac group in Chester County, and it probably is in Philadelphia. It's one large group. It used to be, I want to protect myself from a litigation. I want to protect myself from malpractice. And what I'm seeing are doctors who are just not using their time, their services, and the skills that are available appropriately and spread that out.
Doctors don't work for themselves anymore. They work for Penn Medicine, and they work for big corporations, and they are now employees, and they're the underlings of the insurance company, and they tell us, this is what you're going to do, and this is how much time you have to do it. Now, if I were you, I would make sure my doctor, because my doctor does do this, he works for Drexel, but he spends a half an hour with me, at least, at my primary care visit. And that's what I'm paying him for. And insurance companies and our employers are telling us providers, you've got 15 minutes to do a chronic care visit, and that's not fair to you, and you should shop around for a doctor who spends enough time with you. If you have chronic illnesses or even an acute care visit, should at least be 15 minutes. So when you're in a big group, and it's Penn Medicine, they're churning and burning out their providers. We are producers, and we are making the money for them. So they bill on every visit. And I don't work at a place like that, and I don't want to. And that's why providers are getting burnt out and patients are getting less. They're paying more, they're getting less in their primary care visit, and you can't do a chronic care visit in 15 minutes. So shop around and make sure your doctor is giving you his time, and make sure it's not a big group or, oh, I only have 15 minutes with you today. Well, that's just not enough. And that's what we're being told how to practice with our patients. And sometimes some of these older doctors have their own practices and they're not doing that. They're saying, no, I'm going to spend a whole hour with my patient for that first visit because that's how they want to practice medicine. They want to practice medicine. It's a process. So that's from my corner of the world, that's what you deserve.
Thanks for your question, Larry. It's great to hear some practical things that you can do in your everyday life. On the political side of things, I think it's about continuing to bang the drum with Senator Toomey and with your members of Congress. So again, I think most people in this room probably have Representative Smucker. If you don't, it's probably Costello or Meehan. And so those folks are the people that you need to be in touch with. So I was just with some leadership of the Democratic Party yesterday in Philadelphia, and that was their response was that is the most effective thing. It's working, and to keep on that bandwagon. And that's the best thing that folks can do is to make those calls and to write those letters and to keep them coming. I would also add to that, like sort of specific, why are they throwing the baby out with the bathwater is going to be my question on everything this cycle. There are things that we need to address. We did that last cycle. We were very clear about that. But tweaks to a bill that was worked on for a year and a half, I believe it was, that's a smart way to go. Tweaks to a bill that has been passed and making things better. Why do we continue to start from scratch every time? Again, for the Republicans who are constantly on about saving taxpayer dollars, I can't think of a worse use of taxpayer dollars than to continue to just, things that took a year and a half to do, just throw them out and then try to replace it with something else that's going to take time, money, and energy to produce, as opposed to just taking the time to tweak it. So hitting them on that, and then also the funding of, and again, no one's going to like this phrasing, but there was a piece in the original ACA that the insurance companies, in order for the market to stabilize itself over a few years, the insurance companies would get a contribution from the government to sort of fill that gap in order to stabilize. So what's happening to healthcare right now, when President Trump says that, oh, it's falling apart or it's not working because a key component of that legislation was not fulfilled by Congress. So asking them specifically to fulfill their obligation in that law to do that would actually stabilize the market, and then we could move forward in a better way. So these are specific, concrete actions that you could say to them instead of dismantling it, because then it just becomes a self-fulfilling prophecy, as with many of their tricks. So they dismantle it, or they, as I like to say, cut it off by the knees, and then wonder why it's not working. Well, we know why it's not working. So those are, some things, but definitely keep calling. That's been the recommendation from folks at the highest order, and it's working. So thank you.
I'd add to that if Smucker is your representative, he has an agent and assistant here on Mondays, the second and fourth Monday of every month. That very nice person did not seem like he had heard a lot yet about this concern. And it's certainly, there's no line last time I went. So that is somewhere where you can come and speak directly to somebody who will register your zip code, that you're a constituent, and take down your concerns. I think the other thing to build on what Christina said is there is a tendency, and I see this a lot in my work, it's an emotional reaction people have to go directly from I'm unhappy with what I have now to so this new plan is going to work. But I think we really have to look at what they're proposing, because if you look at, or you even kind of read a gloss on the CBO report on the Senate bill, it does not make, there's no estimation that it's going to make insurance more affordable for the people for whom Obamacare has been a, quote, disaster. What it does is cut taxes, like a tax on medical devices and a tax on tanning salons, and continues to spend money. It takes that money out, and that is where the savings from leaving children and elderly people uninsured and poor people uninsured is going to go. Not to make the premiums, which have for some people gotten higher in the past 7 years, is not going to make them more affordable. There's no evidence it's going to do that. What that money is going to go to is tax breaks. So that is actually what this conversation is about. If you're having a conversation about this as opposed to somebody's complaints about Obamacare, it's a distraction. And I think that's one thing that we kind of need to do collectively is resist that temptation to get pulled in emotionally and become distracted.
Take a good look at the proposal that's before the Senate right now. The way they want to reduce premiums is by reducing services. If you don't have to offer maternity care in a given state, there will be insurance companies selling policies that don't cover maternity. I sold them for years. Okay? As a self-employed person, almost impossible to get maternity coverage in Pennsylvania or Delaware. They will remove coverage for behavioral health services, other things that they don't want to offer. And you see the senator who stands up and says, harumph, harumph, I don't need maternity coverage. Really? Okay, number one, he is quite capable of fathering a child. Maternity coverage covers fathers as well as mothers. In the insurance industry, there's such a thing as a pregnant father. And that's someone who has fathered a child where the mother has no insurance or inadequate insurance, and his insurance applies. So I don't want to hear that. Number two, insurance works how? We all pay, and a small number of people file claims in a given year. So if only the people who want to buy maternity services are paying for it, we lost insurance. There's no insurance there. That is prepaying your maternity costs. So if Senator has his spleen removed, would he call up and say, I want the portion of my premium that pays for the possible eventuality that I would need my spleen removed taken off my bill? And everybody would laugh at him as silly and doesn't understand the way insurance works. He's saying the same thing. It doesn't make any sense. And that's how the premiums are proposed to be reduced. Allow states, and this is the euphemism that's used, to supply insurance that their residents want, which means we'll sell them something that's so skimpy and skinny as far as coverage goes that they can afford it. That's great till you have a claim, right? It doesn't cover anything. We all know that the Affordable Care Act has 10 essential health benefits included in it, and health insurance is not health insurance unless it covers those 10 benefits. That's the definition of health insurance since the Affordable Care Act. And part of this new proposal will be flexibility. They're called waivers. Read this carefully now when you look at it, that states can ask for to vary those essential health benefits. That's how you save money. Medicaid is being redefined. It's a completely different animal under this bill than it has been heretofore. That's what's going on here. And that's $800 billion over 10 years.
People who worked their whole lives, they retired in the late 70s, early 80s, when their income was a fraction of what incomes are today. And their pensions or their annuities, whatever, are a fraction of what they were today. And they thought they'd be fine. In the 70s, they thought they'd have enough money to retire and to protect their health and know that everything is fine. And then they get to a point where they've lived longer than they thought they would live. I mean, our statistics on people over 100 today are just astronomical. And they never thought, and their plans and their retirements never thought they would live that long, but they did. So suddenly, they've run out of money. They've used everything they've had, they've sold their home, done whatever it took to keep going. And they don't have the money for health care. So they become a Medicaid individual when that was never their plan. And I think we're going to see, as people continue to age and age and age, we're going to see more and more of that happening. And again, I think that's why maybe some modification of the Medicare plan would help us. I mean, they've certainly extended how long a person or how much you make and how long you get the money drawn out of your pay. it only seems right that that's where we should start, because Medicaid is ridiculous now, and it's going to be more and more and more people that really, really need it.
Medicare could serve as a health insurance or health care platform for all of us from the day you're born to the day you die. Now, would it have to be modified and changed and made more efficient and some of the problems fixed and so on? Of course. But that's a possibility. That's national health care. It's a matter of that. Every country has it except us, of the first world countries. We are the only one that does not insure its citizens from day one to the day they die.
I guess I have one question and one comment as far as what we should advocate for, and I think several of you were getting at this in your comments. We need to, I think, address the fundamental cost of care. And Patricia, you mentioned one way of doing that, advocacy, but I'd like to know if anybody has any thoughts on where else those savings could come from, because if you're trying to lower the cost of something, unless you lower the fundamental cost of it, the only way you're getting savings is by covering less or covering fewer people, which is what's happening now. So I'd like your thoughts on that. And then also, and this is just an honest question, Senator Toomey was on TV this weekend saying nobody's going to lose their coverage under this bill, and I'm really trying to understand that statement, short of saying he's just lying. So if anybody could help explain that, I'd appreciate it.
The way that that claim is kind of supported is that what they're doing is putting in caps and slowing the expansion. So basically they're grandfathering people out of Medicare. So the 20 million people who will lose coverage, the 22 million people are people who will have qualified, they're projecting in 8 years or in 10 years, but who won't be able to join in, as opposed to going to someone today who's on Medicare and Medicaid and saying, no more Medicaid for you. Yeah, so people will come off if they start making more money and won't be able to come back on if they lose that temporary contract job, or if they have a child and that puts them, now they're living at 133% of the poverty rate. Well, before they weren't, but now they are, but they're no longer able to have the Medicaid expansion. I think it's kind of playing fast and loose with the way you use numbers, but to the best of my understanding, I think that's how they support that claim.
And I was just going to say, and that's consistent as of today. So someone who was at his office today or had phoned in was told by his staff those same talking points that you heard him say over the weekend this afternoon. So they're continuing to say that same line. And again, what we've seen is just that these are all alternate facts. There's no truth here. The Republicans are just consistently lying about whatever it is that they need in order. And you will notice the dates on certain things are 2019, like the dates are post-election cycle for some of them. And the timing's very interesting.
Yeah, I think the timing's interesting, and they keep forgetting that just because you push the timeline back, doesn't really stop. It doesn't stop an individual from aging. It doesn't stop their need for medical care. In fact, they're going to pass that and they're going to need more medical care. Why? Because we haven't addressed it proactively. We are back to a totally reactive system. And they think it costs money now. It's going to cost a fortune if we go into a reactive system.
One of the things that, as somebody who provides health care, that was really compelling for me about the Affordable Care Act is that some of the titles dealt with trying to manage costs, incentivizing outcomes as opposed to just services being provided, and working on the floor as a nurse. I see every day ways where we could, and we have in the years I've been working, pushed to be more cost effective in the care we give. And some of that is increasing proactive efforts, patient education. Some of it is that we don't get reimbursed for problems we create anymore. So that has improved the quality of care we give. It's better for patients and better for costs. If you have a incentive now that you get Foley catheters out more quickly so that they can go home sooner, so that they have a lower risk of infection. And a lot of those changes were initiated by elements of the ACA and also by CMS, things they did with Medicare and Medicare patients. like Pat was saying, if we kind of go back to this fee-for-service model where you can spend as much money as you want if you're treating somebody who has the ability to afford it, is not just that costs will continue to grow, but care will suffer because standards will roll back, standards that have been improving in the past decade.
The medical field is just so aggravating because competition doesn't work, right? Penn Medicine downtown gets a new whiz-bang MRI machine, and Jefferson has just got to have one to compete. And that drives the costs up, okay? So a lot of people point to France as a model for health insurance. They're shaking their head here. It is a system where everybody's covered. It's relatively inexpensive compared to our health care, but it is highly regulated. Another thing you got to watch out for in these bills, and that is block grants for Medicaid. Right now, if you're on Medicaid and you get sick, what happens? You get fixed, right? Whatever, how many doctor visits it takes, or hospitalizations, or what surgery you need, that's what you get. Medicaid pays until you're better or you die, one of the two. With the block grant, and however much money that costs, that's how much it costs. With a block grant, here's $100. We'll fix you up to the point where you spend $100. That's a big difference over the system we have now. That's one heck of a leap to say, we're going to insure you. Remember, the Affordable Care Act changed it, no maximums. Well, there are for Medicaid people if you put them on a block grant to the states. Here's an amount of money, beyond that, good luck.
This is not really a question. I worked in the healthcare field too. I spent my career in human resources on the benefits side of this, working with the providers and my employees. One of the things I know, which Ted has mentioned, is the more people that are covered, the cheaper insurance is for everyone because you spread the risk across a greater population. If you go back to the world before we had the ACA, people didn't have access to preventative care that's part of the ACA. So what did they do if they couldn't afford to see a doctor? They waited until they were desperate and they showed up at the hospital, and the hospitals have the Hippocratic Oath, whatever all that is, that says we have to treat you. And every time they did that, and I'm not saying they shouldn't have been treated, they drove the price of care up astronomically. So the budget numbers that have come out for the House bill and the Senate bill, they don't take that into effect. And the other thing, speaking as a senior now, is when those caps got removed, the lifetime caps, I cheered because I was a single mom and I've had pre-existing conditions, unrated insurance. That was nothing compared to what happens when you face a disaster that you can't plan for. Whether it's a car accident or a cancer or things I'm not going to mention that are equally traumatic, and you get the approval from the insurance company that says we will pay for the care. And 3 days into it, they tell you they won't pay and it's $16,000. And they suggest Medicaid, which back then was a nightmare. But so what I'm saying is that as long as healthcare has been tied to work, which is our model, we have not been able to provide a stable base for people to change jobs, to progress in careers. The world of today requires much more flexibility, and our country would benefit greatly by being more forward-thinking, which the ACA was a big step forward. I have heard nothing great out of Toomey's office. I have been in touch with him since the Monday after the march. Toomey is not interested in the best interests of his constituents. But in any case, the public, the great majority of people in this country, no matter how they voted in November, are beginning to understand that their health care is under attack. And I hope we've got a better outcome someday.
Speaking of numbers, I'm on the opposite end of the spectrum. I generally consider myself fairly fiscally conservative, but one of the things that I don't think people give the ACA enough credit for is the fact that we're starting to bring above board, one, the costs that that Reagan's plan that Debbie mentioned, that gives the hospitals the requirement to provide care to everybody who walks in the door, no matter who they are, how sick they are, no matter how much it costs. We're starting to bring that above board, and that's why we're seeing the skyrocketing cost. Additionally, for somebody like me who gets his coverage through his employer, I look at something like the NHS over in the UK. They pay a 10% tax. Everyone's covered for everything they need. Now we're seeing with the ACA, you actually get a notification that everyone throws away that tells you how much your employer spent on your coverage. So you have two pieces to your insurance. You have the premiums that you pay to your employer out of your paycheck. Additionally, you have a gigantic premium that your employer pays on your behalf. You never saw that before. Now you do. I looked at mine, my W-2 last year. Between my contribution and my employer's contribution, we paid $18,000 for insurance for for my wife, myself, and my two kids. We didn't make $180,000 as a couple last year. So we're paying more than 10% of our income into healthcare. And, for a fairly healthy family, we're not even getting that much. So I'd rather see us move to something like the NHS where it's technically it's a more efficient system than we have now in this supposedly, conservative environment. I'd like to see people advocate more for that, to look at, the real costs that are being, pushed out there and really swept under the rug.
You guys realize the Affordable Care Act applies to about 6% of us. A lot of people don't realize it's an incredibly small number of people. Those are people who buy their own insurance. The direct pays, they're called self-employed people. If you're a carpenter working on your own, you don't have this gentleman's fortunate situation of having your employer pay for your coverage. Your employer, by the way, deducts that cost from that company's taxes. The carpenter cannot. How unfair is that?
I thought that the ACA, part of the law was the essential health benefits and took away the lifetime and annual limits. I thought that applied to everyone. And it's not just the individual market, for the people who can't get on a group plan. Oh, well, when you said that the ACA only applies to the individual market, I wanted to be clear in my own head that, no, these things apply to everybody.
They don't go to Blue Cross and say, I want to buy your plan. They go to Blue Cross and say, here's what I want you to cover. The ERISA plans do, big employers. In the small market, the direct pay market, you literally go to the insurance company and they say, here's what we're offering. And they can put whatever they want in that plan. This is before the ACA. Okay? And it didn't cover maternity, and it didn't cover pre-existing conditions. And it had a annual cap, and it had an annual or a lifetime limit, and all that sort of stuff. And that's what the ACA originally, the repair was there. But does it affect other? Yeah, it has effects on Medicare. There are things in the ACA that affect the coverage that you have in Medicare. There are things like who mentioned it here? The annual checkups and so on are mandated in the ACA to be covered by Medicare. So yes, there are effects elsewhere in the healthcare system, but the big difference is to the direct pay marketplace. And that's only 6% of us.
But, I'm fortunate, right? I have a husband who has a great job, and I have my insurance through him and everything. But if states are allowed to opt out of the essential health benefits, then my husband's company's insurance providers can opt out of that. And I don't think that people who have employer-based health plans understand that, and that the lifetime and annual limits can come back. So this is things that we now take for granted that are going to affect everybody, not just people on Medicaid and not just people in the individual market. So, it's huge.
The rate increase in Pennsylvania this year, 2018, coming year, for marketplace plans, anybody guess what it is, the price increase? It's 8.8% for 2018. And it has been astronomical, sure. But what does that suggest to you? Perhaps that market is stabilizing a little bit, as the ACA anticipated it would take 3 to 5 years to do. The thing that used to get me the most was the guy who shows up at the hospital, says, fix me up, doc, goes home, no money, lives in a refrigerator box on the corner, right? No assets. Guess who pays for that? You do. Because that care, the cost of that care is shifted to the bills, the invoices for the people who do have the coverage. Cost shifting was one of the primary, as far as I'm concerned, justifications for the Affordable Care Act or something like it to begin with. And we're going to go back to that if this deal perseveres here.
Just a comment, but my understanding too from both of these, the House bill and the Senate bill, is that the states will be, one of the exemptions they will have is that employers will not have to cover insurance costs. Now, that's what I've read and that's what I've heard. Are any of you aware of that? They could opt out. So even if you are an employee and you work for somebody, that is not a guarantee that your employer is going to have to cover you. I remember what it was like not to have insurance for a baby, and I worked for a hospital. I had insurance, but we had to pay for the whole thing. I still do. I have a pre-existing neck and back condition. I had to wait at least 2 years before I could see a doctor. So, if young people don't remember this, but we of a certain age do remember what it was like when you had to worry about your pre-existings.
I'd also like to know, what kind of language can I speak to talk to my representatives that they will understand? Or take what I say, is it all about just money, bottom line?
This is life in a big city. That's how you have influence with your representative. You contribute to the campaign at the federal level.
So my question's along similar lines, but 22 million, 23 million, those are really impactful, scary numbers, but they're nameless, faceless numbers. Yes, I think the bottom line is what some people respond to, but that's not necessarily impactful for those of us that have been fortunate to have healthcare our entire lives, right? So I think to a very large extent, I've personally never known what it means not to have healthcare. So it's hard for me to appreciate that, and I think it's probably hard for a number of people to appreciate that. So my question for you is, people that are on the ground as healthcare providers, if you were to summarize or you wanted to capture the impact of the magnitude of the affordable healthcare in one story, what would that be?
Someone in my family has a pre-existing condition and her entire life never had insurance. As soon as the Affordable Care Act came out, she ran and got Medicaid because she doesn't make a lot of money. But she qualified for Medicaid because she's a single mom, and she was not receiving any child support. So she went to this medical clinic, much like mine, just a clinic in Philadelphia, with a doctor she never knew. The doctor took great care of her. She told them about the pre-existing condition. They did the blood work. They treated her for hepatitis C. If you know, there's a new drug, Harvoni, which costs, I think it was $22,000 a month. Guess what? So she has no more hepatitis C because she used her Medicaid and she did the right thing, got all her primary care. She also had a couple other problems with hypertension. But to think that she had to wait her whole life just because she couldn't afford it, and she had hep C, and nobody would take her because everyone knows what happens when you have hep C. Well, this is before Harvoni. She didn't have... So what would happen, the trajectory of hep C would be liver cancer, cirrhosis, possible transplantation, or death. So, end-stage liver failure, but not anymore. So it was like, wow, perfect timing. So that's just a short but sweet story about what happens when you have health insurance with a pre-existing condition, especially this great drug that came out. So we should be able to get people to be able to have access to all these great treatments. And that will save her a transplant, which I won't even tell you how much that costs, like $100,000 with the hospitalization. That's not even counting if you go into rejection.
The absolute lack of care we've had in this country for people with mental health problems. And that's from post-traumatic stress disorder of our soldiers to, people who have had breakdowns with dementia. And that is, I think, one of the biggest things that Obamacare, I will keep calling it that, did for us. And that was give people mental health coverage of some form. And that is going to go away, as well as all the drug addiction care is going to go away. Two devastating things to our society. The people we see today with the guns and the violence, and much of that is, you can draw a line from mental health right back to those conditions and those situations.
So even though I'm pretty young, like I said, I've had a pre-existing condition since I was 11 years old. And what I remember from before the ACA growing up was my father, who started working when he was 9. He worked in the mushroom farms. And he would be up when I would have to go in to inpatient treatment, when I would have to go into the hospital. He would be up after working a 60-hour work week, just calls and desperate. How do I make sure that my daughter's covered? And this was drilled into me from before I started working. Like, you can't be without a job. You have to stay employed so that you have continuous coverage, because otherwise you will not be able to get into the hospital and you could die. And so I've always done that. You know, that's always been my priority, working until the ACA passed, and I've been working for a while when it did. And then my father at this company fell and became totally and permanently disabled. He had a surgery that was covered when he was trying to still go to work by his employer-sponsored insurance. And then because he wasn't able to go back in time, he was let go. And he then got rear-ended by a car, which aggravated this condition, and actually needed another surgery similar to the ones that we do at our hospital. And he spent all of that energy finding the Platinum Plan, getting insurance on the open market. And that insurance was what allowed him to get the surgery that preserved his ability to walk and breathe, because what he had was a lesion on his cervical spine that was pressing into on the actual cord. And they said, you are not going to be able to walk if you don't get this treated, and it's high enough that it's going to impair your ability to breathe. And he got that done a couple of years ago after I moved out here. And so now he's at home. And my dad voted for Trump. My dad is somebody who believed his entire life that if you just did the right thing and you just did what you were supposed to, and you weren't one of those people, that you would have the things you deserved. And he saw really easily how that doesn't always work out the way you think it will. But the thing that is really significant, I think, about the ACA, and what I think we can't go back from, is the fact that doesn't matter. You don't have to be the right person if everybody is entitled to health care. If you start with that premise, then it's not about justifying things that people do or don't need. It's about, does this person deserve to live or not? And that, I think, is a question that isn't a political question, and it's not a question that politicians are in a position to answer. And I think that's what we have to hold in mind when it seems exhausting to keep fighting for this.